Good afternoon, everyone. I'm Ann Williams at CETL in Austin, Texas, and I'll be moderating today's webcast entitled Citizen and Patient Engagement. This webcast is offered through the Center on Knowledge Translation for Disability and Rehabilitation Research, or KTDRR, which is funded by the National Institute on Disability and Rehabilitation Research, or NIDR, in the U.S. Department of Education. I want to thank my colleague Joanne Starks for her support in coordinating today's webcast. A reminder that we will ask you to complete a brief evaluation at the end of today's webcast, and I'll give you more instructions following this presentation. And you may download a copy of the presentation file from the KTDRR's website at www.ktdrr.org. The Center on KTDRR is working with a number of national and international partners, and one of those is the Canadian Institutes of Health Research, or CIHR. We're partnering with CIHR's Knowledge Translation Strategy Unit to learn about the innovative KT strategies they are continuing to develop and implement. This webcast on CIHR's Citizen and Patient Engagement is part of a series of 4 webcasts that also include Ethics in KT, KT and Evidence-Informed Policymaking, and KT 101. Today's speakers from CIHR will describe what patient engagement is and why it's important in health research. We know that the engagement of citizens and patients in health research has shown to lead to better results. Not only are investments in research more accountable, transparent, and relevant to patients' concerns, but patients enhance research teams and offer unique insights or complementary skill sets that only they can provide, leading to innovative discoveries. We'll hear about the strategy CIHR is developing to figure out what components are needed to result in meaningful patient engagement. Joining us to talk about this today are Rosa Venuta and Tim Bell. Rosa Venuta is the project lead for Citizen and Patient Engagement at CIHR. There, they strive to engage citizens and patients in a variety of capacities, such as membership roles on governance committees, corporate and institute strategic planning, in collaborative research approaches, and in knowledge translation. Rosa is a member of the team which recently developed a patient engagement framework for the strategy for patient-oriented research. This initiative is intended to achieve an active collaboration between patients, researchers, healthcare providers, and decision makers in order to improve healthcare practice, therapies, and policies. The framework's objectives promote patients as active partners in health research that will lead to improved health outcomes and an enhanced healthcare system. Tim Bell is an associate in the Major Initiatives Unit at CIHR. Since joining CIHR in the fall of 2013, Tim has supported his team in various aspects of the National Strategy for Patient-Oriented Research, including the development of the Patient Engagement Framework. Prior to CIHR, Tim spent 5 years working with Aboriginal Affairs in Northern Development Canada in corporate planning and reporting, privacy policy, and strategic coordination for the minister. Rosa, are you ready to begin?
I am. Thank you very much. So welcome to our webcast today. We're really pleased to be here, and we're really hoping that today's session will bring about some new thinking and ideas and opportunities for sharing with other organizations who will be listening in on the webcast and will want to reach out to CIHR. So as was mentioned earlier, CIHR is composed of 13 institutes, and it provides leadership and support to more than 13,200 health researchers and trainees across Canada. So we're going to give you an overview of the agenda for today. So we're going to be featuring an overview of CIHR's investments in citizen and patient engagement, and in particular, we want to focus on a new pan-Canadian research initiative, which is the Strategy for Patient-Oriented Research, or as we call it here, our acronym is SPOR. An important goal of this initiative is for patients, researchers, healthcare providers, and decision makers to actively collaborate to build a sustainable, accessible, and equitable healthcare system, and to bring positive changes to the health of those living in Canada. Since patients are at the heart of SPOR, they must be involved as much and as meaningfully as possible in order for health research to be more responsive to the needs of Canadians. We will talk about key strategic areas for patient engagement, about the concepts and the activities that will be needed to establish patient engagement as a core element of patient-oriented research. And Tim will provide you an overview of the strategy itself. We will also be talking about barriers and facilitators. Engaging citizens and patients in research is still very much a nascent field, and as we are discovering, it's a complex process. While undertaking our consultations with patients and patient engagement experts in Canada and around the world, we examined evidence and advice about the barriers as well as the facilitators to making this a successful engagement. Lastly, we want to feature a case study that illustrates a CIHR award-winning partnership between researchers and a community, and it has a strong focus on their engagement in the knowledge translation process. So at CIHR, citizen engagement is meant to ensure that citizens are meaningfully involved in policy or program development, from agenda setting and planning to decision-making, implementation, and review. CIHR is in the process of developing a strategy for citizen and patient engagement that will identify the initiatives and mechanisms that are needed to realize more meaningful citizen and patient engagement in our organization. So it was formally developed as an initiative under the Knowledge Translation Portfolio in 2008. There was a recognition of the important role of citizen engagement in achieving the KT imperative of our mandate. Citizen engagement is meant to ensure that funded research connects with Canadians to improve their health and to strengthen the Canadian healthcare system. A framework for citizen engagement was developed at that time and implemented as part of this formal initiative, and we wanted to ensure that we could promote consistent and coherent approaches for citizen engagement in all our programs and activities. We adopted the definition of citizen that includes interested representatives from the general public, consumers of health services, patients, caregivers, advocates, and representatives from affected community and voluntary health organizations. During an internal scan that we undertook at the time, we looked at opportunities that spanned across a spectrum of engagement activities to inform, to consult, or to engage with citizens and patients. And we discovered that there is a natural foundation for this engagement since CIHR was founded in 2001. In the scan of both our institute-led and corporate activities and programs, citizens were considered key stakeholders who participated in collaborative research funding streams, such as community-based and participatory research, and in a range of strategic planning exercises, both within the institutes and in our corporate governance committees. So CIHR, as I mentioned, involves a variety of patients and patient advocates, and especially within our institute advisory boards. The following is a quote from one such engaged citizen, Mr. Vincent Dumez, and he states, "Citizen engagement is essential because patients bring a dimension to the application of research that in some ways only they can provide." In fact, we have seen a lot of traction for citizen engagement and patient engagement, both in the healthcare and in the health policy sectors within Canada over the years. So Vincent is such an example. He's established as a key collaborator of the Faculty of Medicine of the University of Montreal. He has become a leader in efforts to improve the relationships between patients, physicians, and healthcare professionals. This collaboration has led him to become the director of the faculty of the Office of Patient Partner Expertise of the University of Montreal's Faculty of Medicine. So citizens and patients can contribute in a variety of roles. Citizens who are considered members of the general public with an interest in health research can assist in assessing risk management, in helping to prioritize efforts regarding resource allocations. They can help provide insights into public demand and the ethical and moral considerations of research that is proposed. They help in the development of guidelines on research involving children and adolescents, for example. We tap into them as audiences such as parents, caregivers, advocates, and adolescents. Another example is to tap into the perspective of citizens for their own personal and societal values, their individual perspectives on emerging therapies, for example, or on expensive medicines. Patients can inform us about a number of issues. They can provide us insights into historical injustices around underfunded research, for example. They help to address communities' demands for increased funding in research, for example, within the breast cancer movement a couple of decades ago. They help to evaluate the impact of treatments, and we can also tap into their experiential knowledge to identify research gaps. Increasingly, patient advisors are being involved in the governance committees of hospitals and other healthcare organizations. They help to streamline the care process, they make it more patient-centered, and they also help to suggest ways to bring about more efficiencies in the healthcare system. So, as part of our scan to develop the patient engagement initiative within the strategy for patient-oriented research, we looked to a number of relevant initiatives and research literature that help to identify some best practices and advice for how we should move forward with patient engagement. So this quote is taken from the white paper, Methods for Involving Patients in Topic Generation for Patient-Centered Comparative Effectiveness Research. It was commissioned by the U.S.'s Patient-Centered Outcomes Research Institute. It's an evidence-based review of best practices, processes, and methods for patient engagement that have been studied and implemented internationally. So internationally, we hear that the experience with engaging citizens and patients in research has shown that involving them early on in the design of studies, ideally as early as in the planning stage, leads to better results. Furthermore, and in particular, we hear that engaging patients in health research helps make investments in research more accountable and transparent. And as we hear in Canada and abroad, there is increasing scrutiny of where public tax dollars are being spent. Secondly, patients help provide new insights that could lead to innovative discoveries. They help ensure that research is relevant to patients' concerns. And lastly, research teamwork is enhanced. It's asserted that research teams which engage patients are better able to reflect their needs and their aspirations. And it moves away from the patient as an advocate towards the patient as a partner working within the process. Now Tim will tell you about the strategy for patient-oriented research.
Thanks, Rosa. Hi, everyone. It's my pleasure today just to delve a bit deeper into the Canadian context that we're working in over here at CIHR. I'll give you a bit of an overview into our current landscape here in the country, and I'll tell you about some of the federal government's initiatives through CIHR pertaining to patient engagement in health research. Well, Canada already has a strong foundation on which to build excellence in the domain of patient-oriented research, including its basic biomedical research community, our clinical workforce distributed across the country and across disciplines. We have a highly qualified, internationally respected clinical and health services research workforce, and leading expertise in systematic reviews. We have large provincial and national administrative and clinical databases, which have enabled researchers to assess existing care patterns, make important associations between interventions and outcomes, and observe practice variations. Canada also has extensive experience in multidisciplinary and cross-disciplinary clinical research networks. But despite the quality of this research, Canada faces a big issue, and that is the challenge in turning this powerful information that's being created into high quality and cost-effective care. It's estimated that 50% of patients don't get treatments of proven effectiveness, and up to 25% get care that is not needed or potentially harmful. Not to mention that this care is also expensive. According to the Canadian Institutes for Health Information, in 2013, Canada was projected to have spent more than $211 billion on healthcare, or close to $6,000 per person. So this major barrier exists in that research is often too far removed from healthcare clinicians, policymakers, patients, and other key stakeholders. And there are a number of reasons and factors contributing to this gap. I won't get into the details of them all, but some include a lack of clinical investigators and methodologists with expertise in specific areas like biostatistics, how complicated it is to coordinate research in large multi-center clinical trials, underfunding of patient-oriented research when compared to many other countries, the fact that we in Canada have a decentralized federation structure making research coordination difficult, deficiencies in the development and dissemination of guidelines and their adoption into practice despite their proven value, and the limited role of patients in patient-oriented research. So the solution that we have is the Strategy for Patient-Oriented Research, or SPOR as we like to call it. Now SPOR is a pan-Canadian strategy that was announced by our Federal Minister of Health in 2011. The vision of SPOR is to demonstrably improve health outcomes and enhance patients' healthcare experience through the integration of evidence at all levels in the healthcare system. SPOR represents a coalition, if you will, of federal, provincial, and territorial partners, and this includes patients and caregivers, researchers, health practitioners, policymakers, provincial and territorial health authorities, academic institutions, charities, and the pharmaceutical sector as well. And we are all dedicated to the integration of research into care. So there are many potential benefits that we hope will arise out of SPOR. Internationally, the engagement of citizens and patients in health research has shown to lead to better results. Not only are investments in research more accountable, more transparent, and relevant to patients' concerns, but patients enhance research teams and offer unique insights or complementary skill sets that only they can really provide, and that leads to new discoveries. Patients can also play a crucial role in the synthesis, dissemination, exchange, and ethically sound application of knowledge to strengthen the healthcare system. So patient engagement is integral and overlaid and interwoven throughout the entirety of SPOR. We like to summarize the main gist of SPOR with the following line. Patient-oriented research aims to ensure that the right patient receives the right intervention at the right time. And of course, you can find out more about this strategy on CIHR's website to see the different ways in which the strategy is being implemented. I think it's important just to stop a bit and take some time to define some of the terms that Rosa and I are using today. What exactly do we mean by the word patient? Well, within SPOR, the term patient is an overarching term that is inclusive of individuals with personal experience of a health issue and informal caregivers, including family and friends. And we recognize there may be no catch-all term that fits everyone. The word patient, for example, is meant as inclusive, but may initially evoke a range of meanings or limitations depending on who the audience is. Even so, we're sort of sticking to this definition as we move forward, and this is what we mean by patients in the context of SPOR. I've also mentioned the term patient-oriented research, and it probably deserves some unpacking as well. Patient-oriented research refers to a continuum of research that engages patients as partners, focuses on patient-identified priorities, and improves patient outcomes. It's not just having patients as a subject or including patients in tokenistic ways, but having patients play a variety of meaningful roles as partners in the research and having the results geared towards outcomes that patients desire. Research focused on patients is the cornerstone of evidence-informed healthcare, which is a relatively recent concept of clinical care, but it's huge. In 2007, the British Medical Journal undertook a survey of its readers, and they placed evidence-based medicine as one of the top 10 medical advances of all time. Healthcare professionals and policymakers need evidence to deliver high-quality, appropriate, and cost-effective care. This requires the timely and efficient translation of research innovations from the research setting to patient care settings. It also calls for the evaluation and synthesis of existing knowledge and rapid transfer of what is already known to the clinical setting. So this patient-oriented research is conducted by multidisciplinary teams in partnership with relevant stakeholders and aims to apply the knowledge generated to improve healthcare systems and practices. Therefore, it encompasses both the clinical research side and the health services side. And while a major focus of patient-oriented research is on new discoveries, an equally important focus is comparing new discoveries with existing therapies to determine which interventions are most beneficial as part of usual care. This comparative effectiveness research complements studies designed to demonstrate the efficacy and safety of new drugs or devices prior to their initial use in clinical practice. Now, this all sounds well and good, but for this to happen, a cultural change and the development of capacity for patient-oriented research are very much needed before the desired end goals of SPOR can be realized. I'll talk a bit more later in the presentation about different facilitators and barriers involving patients, but for now, the original impetus for patient engagement in research was an ethical and moral one. It was the right thing to do. It's interesting, Simon Denegri, he's the chair of Involve and the National Director of Public Participation in Health Research at the UK's National Institutes of Health Research. He recently spent some time in Canada and shared with us that years ago when they began their efforts in the UK in public participation in research, it was done out of moral conviction. But increasingly it is being done because it actually has a measurable impact as well, including improvement in the credibility of results and the fact that it's directly applicable to patients. Simon also mentioned to us how the National Institutes of Health Research over in the UK are witnessing the benefits through a growing body of research and an evaluation of patient and public engagement in research. He quoted this particular study that examined 345 clinical research studies funded through the Mental Health Research Network. Studies which involve more partnerships, as in a higher level of patient and public involvement, were over 4 times more likely to recruit to their target. So I'll just finish off with some words from Simon about their progress overseas. We have witnessed a slow change in the past 20 years, from seeing patients as subjects to participants. But there is much more that can and needs to be done to ensure patients are given an active voice in every step of the research process. And with that, I'll just hand it back over to Rosa to speak a bit more about how patients can be engaged in SPOR.
Thank you, Tim. So patient engagement in SPOR and in patient-oriented research, what we found throughout the course of our consultations about the potential roles of patient in research is something that we've gathered through a variety of different patient voices and patient engagement experts, and we've tried to produce some of this information through this visual model. So experiential knowledge is at the core of this model. Patients, family members, and informal caregivers bring a unique and individual voice through the knowledge, the views, perspectives, and their preferences. It's based on their experiences of living with a condition or illness, their experience with treatments, and their experience with their interactions within the healthcare system. Patients' roles can vary according to the contributions a patient is prepared to offer. Some patients have the readiness to contribute as full members of research teams. Some may bring a range of experience, such as in ethics or as knowledge brokers. Others bring the collective voice of specific affected communities. An example is in participatory research methods. Patients are trained as peer researchers and included as a partner in all facets of the research project. They're members of the core research team. So within the strategy for patient-oriented research, we've developed a patient engagement framework, and it establishes key concepts, definitions, and core areas, strategic areas, that is, for patient engagement within the strategy for patient-oriented research. So the first is in governance and decision-making. Patients will be involved in decision-making in both peer review and in priority-setting committees of the different structures within the strategy. It's also crucial to be clear about the roles and the rationale for their involvement so that everyone around the table understands the contribution each brings to the discussion. Secondly, in capacity building. Around capacity building, we want to ensure that we promote a culture change within the research community. We want to establish approaches and mechanisms for engagement in both investigator-initiated and in priority-driven research. We want to identify and develop resources to connect with individual citizens, patients, emerging leaders in this area, and champions, both within the research community and within patient organizations and individual patients themselves. We would like to establish an orientation and training resource platform for all to be involved. And also we want to look at funding opportunities targeted to patient engagement in research. So this quote was also something that we came across in our research scan. Some researchers are concerned that while research organizations are making involvement a requirement for funding or support, not all researchers know how to do it well. And this is also something we've heard around the tables here at CIHR. So some of the questions that are emerging in the increasing literature around patient engagement is researchers need to find out more about who to engage and when or how to engage patients in their research. We need to address the cost implications associated with engaging patients. We also want to minimize the potential for tokenistic engagement. Patients can be protective of who is in the patient space. It's important that researchers hear from both the patient advocate as well as from a range of voices who have personal experience of the health issue. Another point that's been raised is how to change the research culture to value experiential knowledge as evidence. And another piece is how to develop training tools to support patient engagement in research. And Tim will talk a little bit more about patient engagement in SPOR.
So I'll just carry on where Rosa left off with the third key strategic area, which is the development of tools and resources. This is the creation of tools and access to resources in order to implement research collaborations among researchers, patients, practitioners, and decision makers. And these resources would be expected to achieve or facilitate a number of supports, such as creating a pool of patient participants, which is a cross-section of representatives from diverse populations in different geographic, socioeconomic, and cultural contexts, who also reflect gender and age representation. Another support would be to provide education, orientation, and training for patients, researchers, healthcare providers, and decision makers so that they can work and communicate meaningfully and efficiently together. Share best practices on a range of engagement approaches and role definitions in order to meet the needs of a variety of patients, populations, and age groups. Support researchers to identify and engage underrepresented patient groups, and support patients in their efforts to engage or reach out to underrepresented and vulnerable groups. Now, in January of 2014, CIHR held a patient engagement consultative workshop, bringing together 25 participants made up of patients, caregivers, patient engagement experts, and a couple of researchers with an interest in citizen and patient engagement. We listened to what this group of people with just an amazing wealth of knowledge had to say, and using this, we developed a SPOR patient engagement framework. Particularly, we heard some of the barriers we have listed here. A lack of clear roles for how patients can contribute in specific and discrete activities, professional resistance issues, lack of patient engagement performance measures developed within the research project's evaluation plan, tokenistic involvement where there is limited patient voice, which can really signify that the patient's role is diminished, but also that only a small minority of the research team are patients in the first place. Little preparation or training about the research process, and lack of preparation, time, and commitment. But we also heard a number of facilitators as well. It's important that the research has a patient-driven focus because it's intended to tap into patients' priorities and needs. It's important that the experiential knowledge of patients is valued as evidence. It's key that everyone involved shares common sense of purpose and the desired outcomes. Patient engagement is facilitated when we identify and promote models and approaches built on partnership or co-building. And lastly, patient contributors are reimbursed for time and effort. This next slide touches upon the results of a survey conducted by the Patient-Centered Outcomes Research Institute, or PCORI. PCORI is authorized by the U.S. Congress to fund and disseminate research that helps people make informed healthcare decisions and improves healthcare delivery and outcomes by producing and promoting a high-integrity, evidence-based information that comes from research guided by patients, caregivers, and the broader healthcare community. So PCORI did this really fascinating survey in 2012 of patients and clinicians, assessing views on comparative effectiveness research and engagement in research. The patient survey assessed information sources used for health decisions, attitudes towards patient-centered research, and attitudes towards patient engagement in research. Now, the clinical side of the survey assessed information sources used for clinical decisions, familiarity and experience with comparative effectiveness research, and attitudes toward patient and clinician engagement in research. And the results are really, really interesting, and I encourage you to follow the link at the bottom of the slide to look at the entirety of the presentation. But for now, here are some more motivators and facilitators from both of the survey groups. For patients, and this partly echoes a bit of the moral-based motivation we mentioned earlier, they desire something impactful or relevant to them, whether that be helping others with their medical condition, learning about health, helping the next generation, and making research more meaningful to patients. And the last item is getting paid. That getting paid item is interesting, and compensation is actually a very important aspect to consider. Oftentimes, patients have their own lives and jobs, and taking time out of those things to be a partner in research can place strain on them, especially since they're dealing with a health issue. And as such, the time it takes to recruit patients and compensate them for their contributions is important and highlights the reality that engagement can result in increased cost to the research project and increase the overall time frame as well. On the clinician side of the survey, we see that clinicians are motivated by some overlapping factors, such as helping patients receive better care, getting paid, contributing to scientific knowledge, making research more meaningful for patients, improving professional satisfaction, and helping researchers decide what to study. And again, I'd just like to encourage you to take a look at the rest of the survey results, which show some great insights into how patients view their engagement into research. So we're going to switch gears a bit. In just a moment, Rosa is going to take you through a short case study that appears in our CIHR Citizen Engagement Handbook. And it's just one of several great examples of engagement in there. But this one in particular is a nice picture of knowledge translation and dissemination at the community level, and an interesting collection of lessons learned, actually. As a quick backgrounder for you, the Ganawake community is located in close proximity to Montreal, just to the south on the banks of the St. Lawrence River. It's one of several communities that comprise the Mohawk Nation, and Mohawks are a part of the larger Iroquois Confederacy. We want to talk to you today about the Ganawake School Diabetes Prevention Project, which was initiated about 20 years ago as a partnership between the Ganawake community and researchers. It was a community-based participatory research project designed to promote healthier lifestyles within the Ganawake population. Prior to its execution, there were high rates of type 2 diabetes reported in the community, and so it was the community that was mobilized for input into the research project and to ensure that the messages about health promotion and the research results were easily understood and would be used by the community for tangible changes. So I'm just going to throw it back to Rosa to continue on this case study.
Thank you, Tim. So as Tim mentioned, the Mohawk community of Ganawake was the community in question, and the community was engaged mostly through a community advisory board. The community advisory board members were full partners to the researchers who were based out of McGill. They helped to craft the messages for the rest of the community and participated in developing and delivering presentations about the research results. So as we mentioned, this is a 20-year partnership, and it was a recipient in 2010 of CIHR's Partnership Award. And what we said about this partnership that was so remarkable is that there is a significant emphasis on building collaboration and mutual respect between the community members and the research team. The results of this partnership have had tremendous impact both nationally and internationally on the development of the guidelines for research involving Aboriginal people. It reflects a truly multidimensional partnership, and the impact has led to health research, changes in school policy, and in health promotion products. As a result, the partnership has demonstrated a clear impact on how the community now thinks about diabetes prevention. So it was started in 1994 as a partnership between the community of Ganawake, who represent a population of about 7,500 people, who represented both the community advisory board and the researchers. And as I mentioned, its goal is to improve healthy lifestyles to reduce the high rates of type 2 diabetes that were found in that community. In 2002, follow-up data on children in grades 1 to 6 showed early improved nutrition and stable physical activity levels. So the partnership is recognized by both scientific and Aboriginal communities for integrating community and academic strengths to both develop and evaluate the health promotion activity program. In Ganawake, numerous positive outcomes include increased knowledge of the link between lifestyle and disease, an elementary school health curriculum, a healthy nutrition policy for the schools and the youth center, improved eating habits in children. They've also developed an expanding walking path for the community, a stabilization of incidence and prevalence of type 2 diabetes in adults, and foremost, the community ownership of the project. At least 2 community members who participated in this project have gone on to obtain graduate degrees, and other community members are national and international guest speakers at Aboriginal conferences. The results were first jointly interpreted by the Community Advisory Board and researchers, and then shared with the rest of the community. And another product of the partnership is that a team of 6 people, including advisory board members, local nutritionists, and researchers, crafted a 20-minute presentation in lay language. So some of the lessons learned from the partnership is that it takes time to build consensus, it can be difficult to reach an entire community. It's important to test the communication materials first with the community members, and partnership principles are key to the collaboration. So we'd like to end off our presentation with some links to CIHR's website, some of our publications and products that we've developed for both the research community, for citizens and patients, and for also CIHR colleagues. So we'd like to encourage you to look into these different publications, and we thank KTDRR and our colleagues in the KT Strategy branch for involving us in this webcast.
Thank you very much for this informative presentation on citizen and patient engagement at CIHR. I also want to thank everyone for participating in today's webcast. We hope that you found today's session to be informative, and as a reminder, the webcast will be archived on KTDRR's website at www.ktdrr.org. We also have a brief evaluation form and would appreciate your input about the webcast. The link is on the last page of the presentation file, and everyone who registered will also get an email with a link to the evaluation form. Once again, a big thank you from the staff at the Center on KTDRR to our presenters Rosa and Tim. We also appreciate the support from NIDR to carry out the webcast and other center activities. On a final note, I will conclude today's webcast and invite you to participate in the others from this series. Thank you.